Hello and welcome back to my channel, Direct from Doctor. My name is Dr. Shanai, and what I'm going to talk today is quite important these days, and many people ought to know about this. So it's called Angina Pectoris, Angina Pectoris, also called as stable angina. So essentially this is something related to the heart. So most of the people know about it already, but there is a bit of confusion existing, and many people mistake this for the heart attack. So this is slightly different from heart attack. So that's why it is called stable angina. Stable means the person who is having the angina is his health is stable otherwise. So there is no chance of any death in a soon. So that's why it is called a stable angina. So I'll tell exactly what is it in brief words. I'll make it very short and understandable. See, the heart is mainly supplied by three arteries, okay? Three arteries. If there is a block, even in one artery or two arteries, the blood flow will be reduced to the heart, heart muscles I'm telling. So the heart itself needs the blood. Heart pumps the blood to the other tissues and organs, so that they can survive with the oxygen, but heart itself is an organ, right? So heart also requires a blood supply, and this blood supply runs through the muscles of the heart. Okay, there are three essential arteries, and over the years, because of the fat deposit, triglycerides, cholesterol, and all that, there is a waxy kind of substance, which accumulates on the walls, inner walls of the inner lumen. We call it as inner wall of the arteries. Okay, coronary arteries. Coronary means heart arteries. Okay, the arteries supplying blood to the heart. There are three major arteries. So even if one is blocked a bit, say you can say around 20% blocked, okay, nothing much happens, and a patient doesn't feel anything, the person doesn't feel anything, okay, he can lead his life as regular, there is no problem at all, and then it may become 30%, 40, 50, 60, still the person may not feel anything. Once it reaches 70, that is a sort of a limit. Okay, up to then, even then there is a 30% of space remaining, and the blood will flow through that. Okay, blood will flow through that, and the patient still survives, but after 70 or even at 70% of block, the person may feel some discomfort sometimes when there is a more demand for the heart muscles to pump. See, actually during exertion, we call it, exertion, when the person walks briskly, climbs up the staircase, or starts running, or whatever, during some stressful period, blood, the heart needs to pump more blood, to the tissues. The tissues require more blood at that time, so the heart has to work harder. So heart is not able to get the blood supply properly, so which should be more right now. Okay, the muscles of the heart have to work more now, so they require little more blood supply, but that blood supply is limited now because only 30% or 20% of the space is remaining inside that artery at that particular point where the blockage is there. Okay, so what happens in it translates into a sort of pain. It's quite a strange kind of pain, and the person may hold the chest, that's a squeezing kind of pain. It may radiate to the shoulders, ear, behind the ears, lower jaw, and this may happen whenever there is a demand. Upon resting, usually there is no problem, but some patients will get it during resting also. Okay, resting also, if the blockage is a little more, but still the patient can survive. Absolutely no problem about it. Only the discomfort about the pain, the patient is worried about and reports to the cardiologist. Okay, so this is called as angina. So this kind of a painful condition is called as angina pectoris. That's the name. Okay, and it's also called as stable angina because the patient will not die usually. Okay, the patient will not die, but if the same thing progresses, if there is too much demand and supply is less, then there may be heart attack. Okay, I'll tell you exactly when the heart attack occurs. Okay, in these kind of conditions. So here it's only the kind of pain, or the distress or the discomfort what the patient may feel because the blood supply is restricted in that particular artery. So the blood supply, it may be one artery, two arteries, or all the three may be blocked. to more than 70% or little more. Okay, then there are a lot of chances about the patient getting into this kind of a situation called as angina pectoris. Angina. Okay, in short we call it as angina, and usually it can be relieved with certain medications, and the popular medication for this is nitroglycerin. Nitroglycerin. So sublingual tablet we call it as, and the patient keeps one tablet under the tongue. Under the tongue, it immediately dissolves. So under the tongue, because we call it as a sublingual. Sublingual. So lingual means tongue. Okay, sublingual, below the tongue. So that's why, the below the tongue always the absorption is very fast, extremely fast. Okay, so the patient almost gets the relief immediately. So these angina patients usually are recommended to take a box of these nitroglycerin tablets. Okay, they always keep it in the pocket, and whenever the need arises, they take one and pop it, and they're fine. Okay, so what nitroglycerin does? It relaxes the arteries. It relaxes the arteries. The artery which is blocked, and it just relaxes it a bit. Okay, for a certain time of length period. So thereby the blood will start free flowing again to the heart, and the patient is fine. Okay, so this is usually the so these patients usually don't need invasive procedures like angioplasty or bypass surgery. These patients usually don't need. Okay, so this medication is more than enough, but please ask your cardiologist about it. See, whatever input I'm giving here right now is from some of my cardiologist friends. Okay, so they have given this input, and I'm just passing on the information. Don't decide yourself that this is angina. Always, when you have this kind of a pain or excruciating pain or something, it could be heart attack also. So always visit the cardiologist or your physician at least, and get the suggestion on this. They will check it up. They may even do angiography. Usually CT angiography is the best. CT angiography. It happens within a few minutes, and the doctor knows exactly where the block, how much block it is. They can gauge with the CT angiography. Okay, so even regular angiography is also good enough. They will inject a dye into the artery, and it shows on the screen exactly where the blockage is and how much it may be. Should the angioplasty be done and stent be introduced, and all these things are known. Okay, so what is the difference between this angina and heart attack, which may be having the similar symptoms? And confuse the person. Okay, heart attack it usually occurs, where there is a sudden breakage of the sort of platelets and other things which are segregating on the inner wall of the artery. Okay, this cholesterol and this waxy kind of deposit, and also the platelets and all that. So it might break suddenly. It may break loose and damage the inner part of the artery. Okay, inner lining of the artery at that one particular point, and it may form a clot. It may form a clot, and it may block. It may block the passage totally. Then the blood is totally stopped. Okay, then it is called as heart attack. So whichever part of the heart, that particular artery supplies the blood to, gets damaged, and the damage is usually irreversible. It can't be reversed. It leads to the scarring, and normally. Okay, so the chances of the heart muscle cannot regenerate. Okay, it cannot become healthy again, that particular part. So one particular part of the heart may get a permanent damage. So that is called as heart attack. Okay, it can be massive also. So when there is 100% blockage everywhere at one time occurring in all the arteries is very, very rare. Usually 100% of the blockage may be there in one artery. Because of that, suddenly there is a damage inside the artery. So it can occur during exertion, and for example, the patient is already a heart patient, and is trying to run. He is trying to do jogging against his nature. Okay, or there is a lot of stress, sudden stress. Okay, which demands more blood to the heart, or the patient may be gymming, or the person may be gymming. So this has happened in a lot of young patients as well. Nowadays, we hear a lot about persons in their 40s, 30s, 40s, coming across this particular problem called heart attack. Okay, or MI, or we call it as a myocardial infarction. Okay, infarction is damage to the myocardium, that is the muscle of the heart. Okay, so we hear a lot about it, and it can occur during an extreme stressful situation or extremely fatigue, or rather demanding situation in the body, like running, jogging, and excessive gymming, heavy gymming, it may suddenly rupture inside the arteries, and it may form a clot block. So this requires emergency care, like angioplasty, bypass surgery, or whatever. Okay. So this is about angina, what I wanted to talk about, and the basic difference between the angina pectoris and the actual heart attack. Okay, but angina pectoris, if not monitored time to time by the cardiologist, it may progress further, because this blockage may increase and increase and increase. 70% may become 80, 90, 100, and ultimately block totally. Then it's a problem. Okay, then it's a problem. 100% is very rare actually. So before that, the patient will get a lot of signals. Okay, a lot of symptoms will occur, and the person will definitely go to the cardiologist. So nothing to be scared about, but if you know about these things, it's always good. Okay, so that's the reason I'm passing on the information. Further, you must get checked up by the cardiologist. You should not decide on your own what is good for you. See, I mentioned the name of nitroglycerin. Because I mentioned, don't go and buy and think that this is done, this is treatment. No, you have to go to the cardiologist and get yourself checked up. Then only any medication can be taken, because medication without doctor's prescription can be dangerous. So please know about this. The doctor has to decide about it. Okay, that's it. I'm just passing on the information so that if there is any confusion in the mind, it may go. Okay, so we'll meet in my next video. Until then, take care and enjoy good health. Bye.